Within 3 months, we retest again, and we kind of see where the numbers are. It's not an exact science, but what it is we customize it for every person. Everybody's different. Everybody metabolizes things differently, but we want to make sure that what we're doing is the best thing functionally and the safest for you. Yeah.
Is this something, this type of treatment, which sounds very appealing to me personally, is it covered by insurance? Are you
The hormones are covered by insurance. The lab work is covered by insurance. The actual office visits, because of the fact that we take so much time. Usually I'll start by looking at your test. I'll put about 2 hours into a plan for you, and then we sit down for an hour or so in the office. So insurance won't cover those costs. But otherwise, we also in the office do submit insurance claim. We'll give you insurance claim to submit, and we've had patients who have gotten a good reimbursements back. So so that's kind of where we're at. But unfortunately, this type of medicine is something that's very special, and unfortunately, they should recognize it, but medicine doesn't. So, any other questions so far? Okay. So the last thing I'm going to talk about is something also I'm very passionate about, and this kind of what drew me into what I'm doing here with you today. So when I talk about the way that medicine is performed today and the way that we perform it at our office, it's very different because, again, what we have today is what we call protocol medicine. So every single person that walks into the emergency room with any single problem, for instance, they will get the exact same thing regardless of who you are, what the problem is. And this is the reason why I looked at it and said, this is a problem because everybody's different. Everybody has different either genetics, nutritional balance, or hormonal balance. And this is what we look at. So I'm going to go through a bunch of different scenarios and slides with some of my patients and tell you a little bit about what we do. So, the one thing, you could go home and do this at home. Low thyroid is something that's endemic in the society. And what I mean by that is that a lot of times you will go to your doctor, you will know that you have symptoms that seem like you have low thyroid, yet he'll say you're fine. And this is the reason why. The reason why is that the tests that need to be done for low thyroid are at least 4 or 5. And usually, conventionally, they'll do 1 or maybe 2. And the problem is that you're not looking at the entire panel and the entire patient to be able to come up with the answers. So I'm going to give you a little bit of stories about some of the patients that I've had that we fixed that we found that actually are functionally low thyroid. So thyroid problems, weight gain, depression, fluid retention, cold intolerance, depression. And one thing you could start looking at your clients or people if you look at their lateral third of their eyebrow, if they have loss of their lateral third of their eyebrow, like this woman does, that's, like definite thyroid. Regardless of what the lab show, that's definitely a thyroid problem. So also another thing that we found is that joint pain, brittle nails, and also brittle hair are all related to thyroid. So when I'm going to talk a couple of conditions that are commonly treated by conventional medicine as kind of psychiatric disorders, they actually are usually something more like thyroid. So there was a study done in Colorado, and they found that 13 million people, and this I think is on the low end, have thyroid condition that are undiagnosed. And again, the reason is because when you look at the entire picture, you have to look at all the blood tests, and these tests are available. They're not like some random kind of tests out of nowhere. They are available, but if you don't know how to use them and properly take them and put the whole picture together, you won't do them. So, for instance, for thyroid, you need at the very least 4 blood tests to look at the thyroid function, because thyroid in itself, the T4 hormone, for instance, is just a hormone that is the prohormone. It kind of gives the hormones their power to move on, and the T3 is the actually active hormone, the one that actually works. So when the doctors give you Synthroid, they're giving you only T4 hormone. And so a lot of women tell me they've been on Synthroid, they know they have the thyroid problem, yet they're not getting better. And the reason is because they're not converting their T4 hormone correctly to produce the active hormone. So when we put them on natural thyroid hormone, which has both T4 and T3, all of a sudden things start to get better because of the fact that there's a lot of things that go into this picture, and unless you understand it and kind of look downstream and what each hormone is doing, you won't be able to get it. So fibromyalgia, chronic fatigue. Recent story, I had a woman who came in, she's been on multiple pain medications with chronic fatigue. She was just put on multiple psychiatric meds. She basically came into the office just saying, I don't know what to do. I looked at her blood work and I said, it's thyroid. It was clear to me, looking at the picture. We put her on the natural thyroid. Within 3 weeks, all of a sudden, she got off all her pain medicine and she's weaning off the depression medicine. And that's our goal. I mean, our goal is to actually look at the person. And the beauty is that now with the science and the research that have been done over the last 10 years, we have the science to do this, but not enough people are doing it. So in our anti-aging practice, we actually are using the science that is most cutting edge and looking at it and fixing the problem. So that's the real beauty of it. MS is another thing I kind of mentioned earlier. You know, like I said, go on our Facebook page and take a look at some of the articles I have about MS, and one of the last articles we had, about 30,000 people, you know, comment on it, and it was specifically about the studies showing that women actually decreased their plaques. Not only felt better, but they looked at the MRI and they saw the plaques, the MS plaques, which caused the problem, start disappearing. And this was studies done in UCLA, and you could go online, Google that as well, and you could see, you know, incredible things they're doing with E3 estrogen. And the way they figured it out is that women who are pregnant have less exacerbations of MS. And they're like, what is the difference? And the difference is they produce more E3 estrogen. So a lot of these things, like I laugh about, because we learned in medical school, you know, when women are postmenopausal, they have a higher risk of heart disease. But they never explained to us why. So when you put the pieces together, hey, because you have low estrogen, you're at increased risk of developing high cholesterol, high blood pressure, heart disease. But no one ever put that piece together. And these are the pieces that we put together in the office to kind of try to make everything right. Now, stress. Now, I know anybody who's an employee here at Mosaic does not have any stress. That's what Katrina told me. And so I'm going to leave the rest of the people who don't work here. So basically, no, but stress is important as well, because the stress hormone is called cortisol. Cortisol is a hormone that's really important when you're running away from a lion. Because if you're running away from a lion, which, you know, I don't know if there's too many, it's great because it actually increases your blood sugar, so your brain energy gets better. It decreases all the other functions of your body, your hormones, your immune system, all go down because you're focused on getting away from that lion. Now, if you're running away from a lion for 20 years, well, that is the real problem. And that's the whole point, that cortisol actually is the only hormone that increases as you get older. And that is a big problem because cortisol produces high blood sugar. It actually decreases the functionality of thyroid, and it also decreases the ability for the body's immune system to work properly as well. So when you have this kind of long-term stress, what you're doing is you're functionally changing all your hormone landscape, as well as your blood sugar, your diabetes, and all these different things. So, you know, like I said, our evaluations are very different at the office. You know, we have patients, you know, we look at, you know, specific types of things like, you know, cholesterol, diabetes. And what we do instead is, instead of trying to say, well, now you have a disease, let's give you medication, we try to find those answers beforehand. And that's what I love about our practice, because, for instance, I have a patient who came in not that long ago, younger guy, and this is what would have happened to him, but this is how we've changed his future. He came in because he just wasn't feeling right. his sugar levels were, you know, like borderline, which a lot of times you get glucose numbers and the doctor says, fine, fine, fine. And then 6 months later, boom, you have diabetes, here's some insulin, right? So what we look instead at, we look at the specific hormone insulin. Because if your body is making too much insulin, then what happens is that means that your body is not properly taking the carbohydrates and breaking them down. So what eventually happens is for people who have chronically high insulin levels without eating, they eventually start burning their pancreas and the receptors start to not malfunction, and then all of a sudden you have type 2 diabetes. So in our office, we always look at insulin levels besides for all the other tests, because we look to see how's your body using this. And you know, specifically for this guy, the insulin levels when you don't eat should be about 6, just kind of resting around 6. And you know, his sugar levels were fine in the 90s. We did the test, his insulin level, he didn't eat anything when he did the blood test, were 60. So that means that he chronically walks around with high insulin levels, which eventually is going to burn his receptors and burn his pancreas, and he'll be a diabetic, but he won't anymore because we fixed it. We put him on the right herbal remedies to be able to change it. And today, I'm happy to say, his insulin level was 8 and his sugars went down to 80. So that's the type of things that we kind of look at in the office. So I use this kind of slide because one of my most recent patients came in to me and said, you know, my doctor said to me, you know, she went into the office. She never had any issues before. Her blood pressure was high. It was very high. And her doctor said, well, you know, welcome to the club. You know, you're 49 years old. Now here's a prescription. You'll have this for the rest of your life. So our ideas are, we reject that type of idea. We look for the markers to actually find the prevention. Then we look for, if there is a problem, how can we fix it? Maybe nutritional, maybe hormonally, you know, maybe sometimes pharmaceuticals to bridge the gap. So we could do all those things to kind of get you over the hump, but our goal is not to just say, here's a script, you'll have this for the rest of your life, and then 6 months later you'll have another script, because it's not going to fix anything. So our goals are, you know, basically to, you know, rewrite your future, to transform and take control of your health, okay? And we look for the markers and everything as far as that's concerned. So we're going to be doing a series with Mosaic, you know, for the next few months, where we're going to be doing a lot of different health topics. Because like I said, you know, Katrina